Welcome. My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These conversations aim to highlight work that advances the science of health. This, in particular, is part of a series of conversations we are having about current changes to the policy landscape. The goal is to have nonpartisan, science-based conversations, to keep an open mind about potential policy change, even to welcome potential change for the better, but to be analytic about how proposed changes may affect the health of populations. Today, I have the privilege of speaking with Professor Tim McBride. Dr. McBride is Bernard Becker Professor at the WashU School of Public Health. Tim, welcome.
Thank you for inviting me.
So we're going to be talking about proposed changes to Medicaid and how they may affect the health of populations. So Tim, let me start with a big picture question about Medicaid. What role does Medicaid play in addressing health, social determinants of health, and how does Medicaid intersect with health gaps, health inequities?
So it's important to realize that, one of the most important social determinants of health is poverty and income, in addition to other things like race and ethnicity and access to transportation and all that. And, Medicaid is our program that is designed to provide a health insurance for the poor, low-income people, for people with disabilities, people who are elderly. So it fills those gaps, and it's always done that since it was created in 1965. And what we've known about insurance for years is that the highest rates of uninsurance are among Latinos, and then African Americans, much more so than people who are Caucasians. And so just on that metric, Medicaid is a really important thing that fills in the gaps for access to healthcare. It also does a lot of things, which we'll probably talk about later, in terms of helping with transportation, housing, food insecurity, but its main purpose is to help provide access to affordable healthcare.
So let's talk a little bit about Medicaid and its linked to actual health outcomes among, as you said, low-income, typically underserved communities. So number one, talk us through the evidence about Medicaid and what it does in terms of health outcomes. And secondly, talk us through where the evidence comes from. What are the data that are collected to monitor and to document the role Medicaid plays in promoting health?
So we know a lot about this from studying Medicaid for 60 years now, and the evidence we use is a range of evidence, including actual claims evidence, encounter data at the hospital down to the provider, but also a lot of survey data, such as the American Community Survey, National Health Interview Survey, MEPS, which is a data set ARC runs, and so on. From all that, we generally know, and there's hundreds, if not thousands, of articles about Medicaid that have shown that generally Medicaid recipients have about the same level of access to healthcare as people who are private covered. And it's important to realize that, as I mentioned earlier, that Medicaid recipients come in with a lot of chronic disease. So by definition, they're more disabled. They have chronic diseases. Many of them are elderly. The children, of course, are healthier, but the more recent group is the age 19 to 64 population. So we look at things like access to healthcare, access to health providers, preventive care, and things like access to vaccines and so on. And Medicaid really helps recipients get that access, and not at levels that are exactly equal to the people with private insurance, because again, they're more chronically ill and there are some access problems getting access to providers. But generally the evidence suggests that Medicaid recipients have pretty close to access to care, close to the private pay patients.
So let's talk about the moment for a second. So yeah. we're in this complicated moment with respect to federal Medicaid policies. We're recording this in summer of 25. So on the one hand, the president has been explicit, saying he's not going to cut Medicaid. On the other hand, he's also had people like Josh Hawley, who's one of our senators, who have spoken out against Medicaid cuts, but he's balancing that with congressional Republicans who are advancing spending bills to reduce projected Medicaid increases. So what do you make of all this? What do you make of the tensions in the party? And and I won't ask you to predict where it's going to take us, but how does this fit in with the arc of Medicaid, where it comes from and where it's headed?
Yeah, I was thinking about this question before I got here, and you would know this quite well, that when Medicaid was created, it was our social safety net program. And a lot of providers actually really wanted Medicaid to fill in that gap because otherwise, as I mentioned, these people would likely be uninsured or certainly have lack of access to coverage. So interestingly, when I was pondering this question, I was thinking Medicaid's been a relatively popular program among health providers, among hospitals for decades. And to actually come to this moment where Medicaid might, we don't know what the outcome is going to be as of this moment, but it might have fairly significant cuts. So that's really unusual in a way. I think it's being driven, of course, because it's a significant percentage of the federal budget. And the president ran on, continuing his tax cuts. Mm-hmm. And if you rule out cutting Social Security and Medicare interest, which you have to pay, in defense, and then you increase spending on Homeland Security, you got no place else to go but cutting Medicaid. So that's the tension, really. You have people that are, realize that Medicaid's an important source of providing income for providers and access for their recipients, but the budget situation is such that they need to find the money somewhere, and that's where they're looking. I will also add that I think a lot of this tension is around the expansions of Medicaid in the Affordable Care Act. Most of the, if you listen to the debate, it's really about the 20 or so million people that we added during the Affordable Care Act in Medicaid. That's always been a controversial issue where the Republicans had one view and the Democrats have another.
Can you quickly summarize that? What was the Republican view? What was the Democrat view?
Well, so, the Republicans, of course, were not in favor of the Affordable Care Act and tried to repeal it 60 times. And it was, President Obama's probably major accomplishment. And when we started with the Affordable Care Act, we had about 50 million people who are uninsured in the United States. It's now 28. Mm-hmm. So we've cut that down by about 20 million or so. Much of that is through Medicaid expansion to the 19 to 64 population that is generally not disabled, not elderly, not children, and many of them are working, but they're low income. They have to be below 138% of the poverty line.
All right. So let's talk a little bit now about the threat of the moment. So let's talk about how Medicaid cuts may affect hospitals, clinics, doctors, social workers, mental health providers. So what's the risk in the moment?
So, again, if you start cutting Medicaid, the cuts they're talking about, again, we don't know where this is going to land. It's 10 to 12% of the spending. And, and what I like to say to people is, the direct effect, the first order effect is really going to be on the recipients because they will lose access to coverage. Their out-of-pocket costs might go up. But anybody's spending is also somebody's income. So as you pointed out, the money that goes into Medicaid is income to hospitals, it's income to doctors, it's income to social workers, and so on. So this, billions of dollars, hundreds of billions of dollars that might come out of Medicaid, again, we don't know the outcome, are going to potentially hurt rural hospitals, urban hospitals, doctors, and such. So the impact is going to be potentially quite profound.
Talk us through rural for a second, something which you've done a lot of work about. So talk us through the particular threat to rural.
So there's two or three important things about that. We know from research that our center's done and others have done that rural people are more likely to be on Medicaid than urban people by the order of maybe 6 percentage points. And the reasons for that is that rural people have less access to employer-sponsored insurance. And the reasons for that are fairly complex, but basically the jobs in rural areas are not quite as good as ones in urban areas, and they're less likely to offer employer-sponsored health insurance, so people go to Medicaid. And people's incomes in rural areas are lower. There's a higher poverty rates, lower wages, and so Medicaid is an important source of coverage for people, and it's And, it surprises people, and I think some of the people in Congress, that the coverage rates for rural people are higher. But the other important aspect that I tell you, I go everywhere in the country, the number one thing that gets brought up is the threats to rural hospitals. We lost 150 some rural hospitals in the last 10 years or so, and we lost 12 of them in Missouri. Rural hospitals closed, and depending on whose estimates you believe, there are some 400 rural hospitals that are vulnerable right now, meaning that their margins, their profits are zero or negative. And, if they take a cut in Medicaid, many of them say they're going to have to shut their doors. Since we expanded Medicaid, we've had no rural hospital closed since 2014. All 12 of those happened before we expanded Medicaid. We did have one urban hospital close just last week in Missouri, but we've had no rural hospital close since 2014, which is notable.
Yeah. So when one hears you speak, right, it's pretty clear that Medicaid helps Americans afford healthcare. So it's a program that in some respects can seem like an unalloyed good. So why is it so politically vulnerable? And if one were to take politicians or political constituencies who are engaged in good faith, why might they want to cut Medicaid or decline to expand it still?
One way I answer this question is I was chair of the Medicaid Oversight Committee for 9 years in Missouri. Mm-hmm. And, one of the things I learned about it is there's a very much difference of opinion ideologically about Medicaid and what the role of government is. I think that really is what it comes down to. So I think the Democrats believe in, an expanded social safety net. They think that, Medicaid is an important part of that safety net. And if, as I sort of pointed out, without Medicaid, we would, people would not have access to affordable health care and prevention and all the health outcomes we talked about. But on the conservative side, a fair statement about what their point of view is, probably a kind of a libertarian point of view, is that the role of government should be more limited, and that Medicaid should be, access to the poor, the safety net should be funded by uncompensated care, charity care, and, probably the harsher view is people should just go to work and get a job and get insurance. So I think, frankly, it's really a stark ideological debate.
So do you think there's any opening for a new consensus on the right in support of some form of Medicaid or a more sustainable, less contested status quo for the program?
I've been somewhat surprised by the way this debate has gone because, there's been a really strong push to get the evidence out there by those of us who do that, but also the advocates have pushed really hard to push for an understanding of Medicaid in the media and Capitol Hill. And so when you look at people's point of views, the public is 83% in favor of Medicaid, a favorable point of view of Medicaid. And so something has happened that, and I think this is the tension we have right now is people know that Medicaid is important. So that, now what do we do with that? If we also think it's expensive and we have a healthcare system that's expensive and, that I think is the tension. So the good aspect of what's happened in this debate is that we've raised attention to the role of Medicaid and the role it can help providing access to affordable health care and improving health.
I like that in the silver linings category.
Yeah.
Let's narrow down to Missouri for a second, something which you've written a lot about and you've been deeply involved in this in Missouri for a long time. So you, through the Medicaid Policy Analysis Lab, release a series of regular policy briefs about how Medicaid policy shapes trends here in Missouri. So talk us through the key features of Medicaid enrollment here and how do they reflect or not reflect national trends?
And, thank you for acknowledging that. We've, our job of our center, I think, is just to put evidence-based research out there for people, and whatever they do with it, we can't control that. So what we've tried to, to answer your question, Missouri has 1.3 million people in Medicaid, about 20% of the Missouri population. Again, through work we've done and others, that we know that it's a higher proportion of rural people in Medicaid in Missouri. It's, disproportionate rates of coverage for African Americans and our small Latino population, but the vast majority of people in Medicaid are Caucasians, low-income persons. The biggest change in Medicaid is that we expanded Medicaid in 2014 and through a ballot initiative. Mm-hmm. We're one of only 3 states that put Medicaid expansion in the Constitution, which is going to be extremely important as we go down the road. And that's led to about 350,000 people on Medicaid that are in that age 19 to 64 group that were not covered by Medicaid before that. You know, Missouri's kind of an unusual state in a lot of ways. One way is we, through Senator Kit Bond years ago, paradoxically, we had the second highest eligibility level for children in the Children's Health Insurance Program, second to Massachusetts. So he was always a big proponent of children. But yet we had some of the lowest eligibility levels for the custodial parents, like 20%. And we had some of the lowest other, provider rates. So we have this paradoxical Medicaid program, which is generous to certain populations, but not generous to other populations. And the Medicaid expansion filled that gap.
I know it's a particularity, only 3 states have this, but just for a quick second, guide us through the Medicaid expansion in the Constitution, implications of that if there are significant cuts to Medicaid expansion in the moment.
It's a really important question that I actually don't, I've been on many phone calls where people have asked that question, and I think people don't know exactly what would happen, but what most people believe is it's literally written into the Constitution. There's words in the Constitution that voters put in by a 53 to 47 margin. And there was a challenge to that went to the Missouri Supreme Court. And they voted unanimously, it appeared, to say it's in the Constitution, the voters put in there, you gotta do it. So if you reverse that and you say, okay, say, for example, again, we don't know what Congress is going to do, but if they remove the enhanced funding for Medicaid through what's called federal matching assistance percentage, what would the state do? The state's going to get hit with billions of dollars in funding that they have to find somewhere in order to fund those 350,000 people. Most people suggest that we're going to still have to fund those people in the expansion group. Mm-hmm. But Missouri is a low-tax state, and where are they going to find $3 or $4 billion? My guess, what I've been telling everybody is, if you can't cut the Medicaid expansion group, which it appears legally you cannot, then I think what we're going to have to do, and there's certain mandatory things that Medicaid has to cover, like doctors and hospitals, and outpatient and so on. There are certain things that are not mandatory, which I think would be on the chopping block, like dental services, mental health services. And so I fear that that's where we would see the cuts. We cut dental services before in 2005 and added it back in. I also think there would be significant cuts to provider payment rates, like to the hospitals and so on. Because where else are they going to find the money?
Right. I'll ask one more of the sort of dark questions, then we'll try to end on a bit more light. Work us through, project through, if there are some of these cuts to Medicaid that are currently being discussed, what would you expect to happen to the health of residents of Missouri in the coming 5 years?
Well, we have really good evidence on what Medicaid expansion has done to improve health. It's improved access to health care, it's improved the timing of when people get health care, it's improved prevention. So there's now hundreds of studies, not in Missouri, we're doing some of them right now in our center to demonstrate, really almost only positive results from the expansion. So if you reverse that and you start cutting the population, you're going to start seeing, again, people delaying healthcare, going to the emergency room as their main access point for, not going to the doctor's office, going to the emergency room. So they'll be delaying care, they'll show up sicker. This is what we saw before Medicaid expansion happened, or whenever Medicaid fills that gap. So I think what we know is that people will show up for example, later in their cancer diagnosis, they will not do prevention. They'll have problems with things like asthma, and we will just see a series of negative outcomes, not to mention the negative outcomes on the providers.
Zoom back out for a second. So you have this program which has done enormous good for the decades it's been around, even more since Medicaid expansion, which is now about 10 years old.
Yep.
But it's expensive, and in a time of ongoing ideological challenges around how one creates a budget that the country wants to live with. I won't even use the word balanced budget. It makes the program fragile. So what are your thoughts? Like, how does one make this kind of program sustainable in the long term, politically sustainable in the long term?
I will, I thought about this question. I would just say that it's a challenge. It's a really big challenge, and I'm not sure we have the answer. A couple of things I will say about that is the Medicaid problem, I think, is systematic of the whole healthcare problem. Our rising costs in Medicaid result from our rising healthcare costs. So to sort of lay it on the Medicaid program as the problem, I think, is not really the right way to do it. We really have to attack the whole healthcare system problem. Number two, the thing that gets me very scared, I guess, is we are in the middle of the retirement of the baby boom generation, of which I'm part of. And, we're going to see a doubling of the aged population from 35 to 70 million in the US, and it's doubling in Missouri as well. And why that's important is, even though the aged and disabled population is 25% of the Medicaid population, is over 50% of the spending. And because they, each one of those folks costs, well over $10,000 per year. Children are cheap. So if we just keep adding more aged and disabled people to the population, which is inevitable, it's going to happen, we have to confront this challenge. And frankly, I don't think this should be a state problem. I've been advocating for years the federal government's got to take this on, because states like Missouri or Mississippi or other just don't have the resources to pay for the aging and the baby boom and our rising disability population. So, I think that is the challenge that we're not really talking enough about in this debate, frankly, the long-term care challenge. And we're talking about, I think there's way too much attention on, say, the expansion population or workers and that kind of thing. I think we should really be talking about the 50 to 60% of funding that goes to the disabled and elderly, and what are we going to do about that?
So we've talked about this pretty. It's a pretty heavy conversation. So let's end with hope. What gives you hope in this space?
The thing that I have hope about is this debate has brought attention to Medicaid and its important role in our healthcare system. And, I think, I've been toiling in this for over a decade now. And a lot of times people say, well, the Medicaid program is flawed and, it's got all these problems. But what I've been encouraged about is, this political debate has brought attention to the importance of the Medicaid program to our healthcare system itself, to those people who are on Medicaid, who, across the ideological spectrum, people will just say, oh, I want to take care of those people. And, I think that's encouraging. So oddly, in a way, it's been a very contentious debate, but it's also brought attention to the positive aspects of the Medicaid program.
I like that. I like the silver lining.
Yeah.
Tim, thank you for everything you do. Thank you for talking to us.
Great. Thank you.
Thank you.